So this is the first year where we're not only facing COVID, but also increased influenza activity and unusually high levels of RSV. These are two other types of viruses that can also cause some of the same respiratory symptoms as COVID, but can also cause severe respiratory disease or even life-threatening disease. And while all of these diseases can sometimes cause milder illnesses in most older children or younger adults, they're all especially dangerous for our youngest children, our oldest adult community members, and people with other medical problems. And right now, we are already seeing these diseases hit our youngest children and impact our hospitals and our doctors' offices to get care for these children. So with the holidays approaching, it's especially important we do everything we can to prevent these diseases. For the viruses that do have a vaccine, that means getting vaccinated right now as soon as possible. We have vaccines for influenza, and everyone 6 months and older is eligible and needs to have one every year, so making sure we've got the latest flu shot this year. For COVID, we have the new bivalent COVID boosters, and everyone age 5 years and older is eligible for those. And then our children age 6 months to 5 years should also have already received their primary series against COVID. Now, for RSV, there is no vaccine. We have to rely on what are still incredibly helpful, powerful tools to prevent the spread of RSV. These are things like washing hands, wearing masks when indoors, and keeping sick children away from each other. When we're sick, staying home, keeping kids home from school, even keeping siblings apart from each other, because what can feel like even just a mild cold in an older child or an adult can be life-threatening for young babies. Now, in addition to the concerning reports you're going to hear more about from our hospitals and pediatric doctors' offices, public health is also using cutting-edge science to track these diseases and gauge our response. Today, the Public Health Department is releasing a new tool that will help the public monitor the levels of flu across Santa Clara County. This tool tracks levels of flu in the wastewater to tell us about spread happening right now in Santa Clara County. The tool can be accessed by going to sccphd.org/flu data. That's sccphd.org/FLUDATA. Wastewater analysis is already playing a pivotal role in how we respond to COVID by tracking community spread. It provides us an early warning system long before case rates start to go up or hospitals get inundated, which allows us to let our hospitals and healthcare systems know what they're about to expect. Now we have a similar flu wastewater dashboard available for the public. And people can use it almost like a weather report, where you can look to see what is the activity of flu in my area, in my community, and what do I need to do right now in response. And I'm here to tell you today that right now the wastewater are showing rising levels of flu in every part of our county, in every sewer shed that we monitor. And that means for every community member here in Santa Clara County, it's time to get your flu shot, as well as your COVID booster, and use every tool you can to prevent these other diseases spreading. So to stress again, now is the time, but it is not too late for these interventions to make a difference. Getting a flu shot, getting up to date on your COVID booster, and using tools like washing hands, wearing masks, keeping sick folks away from healthy ones, especially little babies and our vulnerable community members, to make sure that we curb the spread of these respiratory illnesses, all three of them, across our community. Now, thank you. I'll pass you back to Erin, and I'll be here to take questions at the end.
Now going to bring up Dr. Vidyamoni, a pediatric infectious diseases specialist and associate hospital epidemiologist at Santa Clara Valley Medical Center. Dr. Moni.
Good afternoon, everybody. My name is Vidyamoni. I'm a pediatric infectious disease specialist and the associate hospital epidemiologist at Santa Clara Valley Medical Center. I want to thank Dr. Rudman for her thoughtful comments that she just gave right now, but I also think it's really important for everyone to understand what is currently going on within our hospital system. In the past couple of weeks, both in our inpatient and our outpatient settings, we have seen an acute surge of patients, specifically in our inpatient setting, in both our inpatient pediatric ward and pediatric ICU. The predominant cause for these hospitalizations are secondary to respiratory viruses, specifically RSV. As an enterprise healthcare system, we have worked with our care teams and our leaders to expand access and come up with mitigation strategies in order to accommodate this increased surge of patients we are seeing right now. But with this said, we really need your help. We need you to do the things that Dr. Rudman was just saying right now to help us prevent hospitalizations. So I'm urging you today to please get yourself vaccinated against the viruses that we have a vaccine for. I've also seen an uptick in COVID-19 infections in our pediatric patients in the past couple of weeks as well. So please get yourself vaccinated against COVID-19 and also get your influenza shot now. We are seeing an uptick in influenza now, and the rate is slowly rising every single day, and I have no doubt in the next couple of weeks we're going to be surging in influenza as well. The next thing I would really recommend is continue to wash your hands, and frequently. Many of these respiratory viruses are spread through droplet and through contact. And the way to prevent transmission is to just wash your hands. So please remind your family and yourself to frequently wash your hands. And finally, if you are sick or anyone in your family is sick, please stay at home. Don't send your child to daycare or school, and please don't go to work. This is the easiest way to spread the infection to other people and increase the burden on our healthcare systems. We are all in this together, and we have been for the past 3 years, so let's keep each other safe and healthy. Thank you all so much.
Thank you, Dr. Moni. And if there are any hospital-related questions or questions specifically for Dr. Moni, she'll have time for just a couple as she has to get back to her other duties, and so we'll have time for about two questions now if anyone wants to start. Let's right if anyone wants to go first.
I'd like to ask.
Yep.
Would you mind telling us, I mean, I know we've been tracking this with COVID over the last 2 years, but how serious is this surge right now? You know, people have been looking at hospitals for a while now. How is it comparatively, and how is it compared to, you know, the flu 3-4 years ago?
Sure. So RSV specifically, so it has not been, we have not seen RSV to this extent in a few years, secondary to the pandemic. We've also seen intraseasonal variations of RSV. So in the past couple of years, RSV was more or less surging more in the late summer season, which is an atypical time period. And right now, we have seen an abrupt increase in all of our RSV cases. I mean, if you look at a lot of the curves, it's almost linear, especially across the nation and within California and in our health system. So this is significantly more than we have seen in quite a few years right now.
Are they nearing capacity?
We have been expanding capacity specifically in our healthcare system under the guidance of our regulatory and our physician and nursing leaders. So we are doing everything we can specifically in our system to make sure that we can accommodate everyone.
We'll have time for 2 more questions here.
So I heard in the way that this flu season has been described is 2 things, and they sort of dovetail, that maybe this is a stronger strain that's circulating this year, and maybe our bodies and our immune system is less prepared for it because of the protections that we took during the pandemic. Is that an accurate description?
I'm going to attack the latter part of your question first. So our immune system doesn't necessarily just turn off because we're wearing a mask or we're washing our hands. Our immune system is constantly working and fighting off infections on a daily basis. That being said, a lot of these viruses that we were seeing pre-pandemic were in decreased circulation. So if you're not exposed to those viruses, you're not going to get immunity to it. So a lot of the children specifically who were born during the pandemic, or even our younger children, were not exposed to a lot of these viruses, are now seeing it at this time. So with that said, I'm not also sure that I would say that the strain of influenza right now is stronger than before, but it is just surging right now. And that's why it's really important to ensure that we continue to promote vaccination, because we know that it works and it helps prevent hospitalization, specifically in influenza and COVID.
And final question specific to Dr. Moni. If not, we'll let Dr. Rudman carry the rest of the Q&A.
Yeah, I got one. Are you guys seeing an amoxicillin shortage like the rest of the country is seeing right now?
Yes, we are seeing an amoxicillin suspension shortage. So let me make it clear. It's not within the capsules or the tablets. It is in the liquid suspension for amoxicillin. There is also a back order in the amoxicillin chewable tablets. We have worked with our Pharmacy and Therapeutics Committee to come up with alternate antibiotic regimens to give to our physicians and providers to use in order to prescribe safely and not cause any over a prescription of antibiotics. Thank you for that question. That's really important.
All right, Dr. Money, thank you so much for joining us
Thank
here
you.
today.
Thank you all so much. Appreciate it.